Hello, Dr. James Bogash, expert in health and longevity, and as a practicing chiropractor, this particular study really, it's something I deal with all the time, but it's frustrating for me. And this was a survey, national health interview survey, and they found out that in the adults that were surveyed, that 1 in 4 of them deal with chronic pain. Now, chronic pain is pain that happens that lasts longer than 3 months, and of this group, 8.5% had what they considered as high impact that affect their activities of daily living, that was present on most or every day. And so, you could argue that we really don't have any good mechanisms to treat chronic pain, but that would be arguing it from a drug standpoint, and we all know what the whole opioid crisis did. Opioid doesn't have an impact on a condition, it just blocks pain receptors. So the other thing in the study is that people got older, they were more likely to have chronic pain. That's probably not a big surprise, but I've addressed this multiple times in the past, and I have this conversation often in my practice, but I really feel that the reason we have so much chronic pain is that we mismanage the acute side of things. So, and then once we get to the chronic side of things, if we mismanage on the acute, we're probably going to mismanage the chronic side of things. So, here are 5 tips to make sure that you don't become a statistic, or if you are already in a statistic, to maybe move away from it. And number 1 is to manage the acute scenario. That means don't ignore problems. I recently did a video on how I had pretty severe knee pain after a jiu-jitsu class the day before Thanksgiving. No injury or anything, but an hour later by then I was limping, probably some degree of meniscus injury in hindsight. And it's about 95% improved. But I started working on it just with a massage gun like that night, and continued to work on it, and still continue to work on it until that pain is completely gone. And I'm confident that it's not going to be an issue once it's all addressed. Number 2 is movement. Whether we're talking about acute or chronic, you have to be moving. You will not get better sitting on the couch. I don't know how much more I can stress that. But most people, when things start to hurt, they go the opposite direction. They're fearful of making things worse, which is almost never going to happen unless you're going to get into a Krav Maga class or full contact MMA training or something. But in general, exercise is not going to make a condition worse. We certainly have to be careful when we're exercising, letting pain be your guide, but you need to move. Movement is absolutely one of the key components for managing acute and managing chronic pain. Number 3, I am very much against anti-inflammatories. Now, if you have an actual initial injury, you can certainly use ice on that injury to control the inflammation for the first 24 hours. After that, consider inflammation a hill. We want to keep the hill smaller, but after that, we need to get over the hill. In anti-inflammatories, there is lots of evidence, and my strong personal opinion, that it keeps you from getting over the hill. So you stay stuck on the inflamed side of things because you can't heal. You're actually inhibiting your body's ability to heal itself. And certainly, like for my knee, I didn't even consider taking an anti-inflammatory. Quite frankly, I haven't taken anything like that in near on 30 years. And I don't really, other than an elbow dislocation, I really don't have anything, or an elbow dislocation a decade ago that still has some limitations. It doesn't hurt me, but I don't really have any other symptoms or anywhere else or anything that bothers me. Number 4, an anti-inflammatory lifestyle. Lifestyle choices do matter. The diets that we have, if you're carrying too much weight around the middle, that becomes its own inflammatory organ. But our diet, an anti-inflammatory diet, will help control all levels of pain. And The last one is self-treatment. I have a lot of conversations with patients who have both acute pain and chronic pain, that truly recovering from these scenarios or improving them is going to require some degree of self-treatment. Now, this is obviously not good for my business to teach patients how to work their own soft tissues at home, but my ultimate goal is to destroy my practice, and that involves the use of massage guns for acute injuries, massage guns, cupping, foam rolling, movement stretching. For chronic pain, things like soft tissue or instrument-assisted soft tissue work, maybe massage gun, eccentric exercises. There's a lot of tools that people need to be taught so they can manage all these things or recover from them at home. So, as always, I will post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.